Welcome to On Call with the Prairie Doc After Hours. We had many great questions submitted beyond what we could answer during the broadcast portion of our show. So let's get started. Thank you for these questions. And we're going to go quick answers. One man from Parker says, I diagnosed myself with rhinitis after months of sneezing, and he used fluticasone propionate. Did we answer that? I don't know if we did. We said,
started that.
You know, it was a cold, used the Vaseline. Sioux Falls man says his coworker is undergoing surgery for brain tumor. What support can they give him? How can they help their coworker through this? And I will speak to that. I think there's not one thing that you can say that's wrong as long as you speak from your heart with kindness and honesty. Just be there when you can.
Offer to help.
Huh?
Offer to help. That's
what can we do to help? And let me come and visit. Can I come and visit you now? Can I come and visit you now?
A phone call, a card, you know, anything just to let them know you're thinking about it.
Cards are really appreciated. Emails, you know, people appreciate those things. Tyler?
Ask the hospital. They've got resources. Use the staff. Don't, like you said, be afraid to ask questions. There's social work that can discuss things and use what the hospital has available.
Wise advice. Rapid City man says, my wife has dementia. She's ongoing urinary tract infections. Last week I was informed she had another UTI and that she grew bacteria in her urine, but her doctor and the urologist said that the person is showing no symptoms. The body language does not indicate pain. They're saying to leave it alone. Should something be done? And the answer is leave it alone. Most common thing we see is, I bet you 3/4 of the people in a nursing home have a urinary tract infection, or at least a bacteria in their urine. Doesn't mean it's infection. It's a live with it symbiotic thing.
Asymptomatic bacteria is a fancy name, but I've dealt with this. I'm sure you have for years, Rick. And my temptation decades ago was I ordered antibiotics for them, and that was the wrong thing to do because we've developed organisms, you know, bacteria who are not sensitive to the antibiotics, and we're creating a large problem. So I would heartily agree that the best thing to do is ignore it. Yeah.
You know, and what's more, sometimes if you treat with an antibiotic, you give it an overgrowth infection in the vagina, and then you have vaginitis, and it feels like a urinary tract infection, and now you've started an unholy war that goes on
Keeps
for
on and on.
Terrible. Leave it alone. If there's anything you want to do, go to vitamin C, 1,000 milligrams 4 times a day. I've done that, and I found great success.
Acidify the urine helps.
Acidify the urine. A man from Lexington says, I had a bleeding problem and came to find out it was because I was taking aspirin for atrial fib. I'm no longer taking aspirin. Is there anything I can take in its place? Well, if you've got atrial fib, you need to be on an anticoagulant, or if you can't be on one, you need to be monitored. This is a complicated situation. You make sure your doctor knows about all of this. A New Holland woman says, on the news we heard about the measles outbreak. Are there permanent side effects to measles?
I believe there can be. It's been so long since I've seen a case of it. I don't purport to be an expert in the area, but yes, it's certainly possible that you can have long-standing complications. It's very worthwhile keeping your vaccinations up to date.
You know, the people, if you get the measles, the population that has measles vaccine is getting smaller and smaller, so the herd immunity is getting weaker and weaker. And so you give measles to a pregnant lady, that baby's going to have congenital heart disease and a variety of bad things, anything.
Death.
And death.
Which,
you know, there's such a thing from measles. I have calcified tendon in my heel. What treatment can be done? I've had a cortisone shot, which lasted about 6 months. Orthopedic surgeon suggested get heel inserts. Seems to have really flared up. I've been icing it, doesn't do much for it. The last thing he wants is to have it removed. You don't leave a calcification, you don't remove a calcification, right?
No, well,
It depends.
It depends. One thing I'm very cautious of is I will not do a corticosteroid injection to the back of the heel without ultrasound guidance or some sort of way of knowing that I am not putting that towards the tendon, because there are studies that have proven steroids to a tendon cause ruptures. And the Achilles tendon is not something you want to rupture, which would likely result in a surgical procedure.
It's bad news, isn't it?
Bad news. The other aspect is, depending on how calcified it is, the only way to definitively get rid of that is a surgical procedure. There are conservative measures that can be tried, but likely needs surgery to get rid of that, which is, it's about a 3 to 4 month recovery depending on how active, age. There's multiple factors. Discuss with your surgeon, discuss with podiatrist, see someone that deals with this on a daily basis.
Okay. One man says, I've had a common cough for a couple years, spit white mucus, tested negative for lung cancer, but I've had leukemia for 4 years. I take a nebulizer and an inhaler, which doesn't help. What are the recommendations of other things I can do to get rid of this cough?
So
It's a complicated,
yeah.
this person's got leukemia,
is it the cough that he is
chronic cough, negative for lung cancer, leukemia for 4 years. White mucus, has been on a nebulizer. See, I would immediately say the first thing is a nebulizer or an inhaler, a lot of those kinds, but it depends upon the kind of problem. So sometimes,
is a steroid a possibility in terms of inhaled substances, but you need to know maybe a little bit more about the workup of the lung.
And what kind of inhaler have you used?
Yeah.
Because there's also the other kind for COPD that seems to work for certain people. None of it's great. It might be you're just going to have to live with a chronic cough. That happens.
Absolutely.
Sometimes the cough perpetuates itself. You know, the more you cough, the more you irritate. The more you irritate, the more it
always tell people that the cough is there to get the material out of your throat and lung, and so it's there to some degree for a good reason, to clear it out, and just getting rid of it may not always be in your best interest.
True.
Assuming there's no infection.
Right. An Aberdeen woman says, both of my feet swell so bad, and I was just wondering if that has anything to do with my heart or diabetes. They're very puffy and they get pretty tight. Tyler, swollen feet.
It could very well be due to diabetes. There's also venous stasis or venous insufficiency, where the valves in the veins of the lower extremity aren't functioning properly. Could be calcified, which is not allowing blood flow back the proper direction. It could be due to diabetes. There are other causes: lymphedema, venous insufficiency. See your podiatrist, see your primary care, even a vascular surgeon if there is a major concern for that, and there are workups that can be done.
Right. You know, peripheral edema is something that I dealt with all my medical life, and the right diagnosis is important. It can be venous disease or stasis, but it can be cirrhosis, nephrosis, congestive heart failure. Yep. And those, the liver isn't making enough protein, so you get leaky blood, and that's from cirrhosis. And nephrosis is kidney disease, and you're not getting rid of the fluid, and so you have a fluid overload. And it could be heart failure because your heart. So there's a lot of reasons for edema. That's a tough bugaboo to try to solve.
The good proper workup. I mean, I think you can solve the problem with that.
Oftentimes, if it's venous, you can use ACE wraps as long as the blood flow is good. Arterial blood flow is good enough.
Yep.
66-year-old woman with Sioux Falls asks, what types of issues do people have that they should bring to a podiatrist? How often should a person go to one?
Very loaded question. Diabetic, you should see your podiatrist every 3-6 months. That's something you should discuss with your foot doctor. What I would recommend is, if you have a problem that, you've tried some things that you kind of standard across the board, whether it's anti-inflammatories or inserts, shoes. If it's something that is not normal to you, it doesn't hurt to have it evaluated, whether it be x-rays, whether it be just a physical exam done by a doctor. Certain things that you should bring if, obviously if you feel like your toes are getting too cold and that's never happened before. Things that are acute, meaning very abrupt onset that don't seem normal to you. it's something that definitely I think would need to be evaluated, but it's very case by case.
Yep. Every situation different. Go to see your podiatrist. An Aberdeen woman says, I was washing dishes and told the cat to get off the counter but was unable to get the words out. This has happened a couple other times when only gibberish comes out. Physically, I feel well, but wondering what tests should be done to find out the cause. I think she's having what is called a TIA.
Sounds like.
What do you think needs to be done?
Well, she needs to see a physician and an evaluation of the, the vascular structures going to her brain, and making certain that there are, heart arrhythmia could be a possible cause for it, but certainly needs evaluation. She's at an increased risk for a possible CVA or stroke, as we say.
Yep. So get in to be seen. Would you start her on baby aspirin a day?
I think I would, yes.
Me too.
Assuming that no other reason not to.
Yeah. Well, and I don't. If it's a reversible thing that happens periodically, get on aspirin. That's often the final treatment.
Yes, that may be what it takes.
If there's a significant obstruction of a carotid, that would be worth looking into too. An Ottawa man is wondering what causes night terrors, as his wife has them often. You have a good answer for that, Steve?
I don't. I've heard of it, but and had people complain about it to me. I don't know that I have a good answer. Again, you look at medications they're on, their sleeping environment.
Yep.
Is there a history of problems that were not addressed? But it's complex. I don't know that there is one simple answer.
And I would wonder about sleep apnea in people who have night terrors. But I would say this: we're going to have a sleep a show on sleep abnormalities coming up in about a month. Keep watching, and we'll have experts on this. We'll have a neurologist and a pulmonologist on sleep disorders, and we'll answer sleep terror if you ask that question again. Parent is wondering about their 4-year-old who has a wart on their foot, for which they've applied over-the-counter wart removal 2 times, still hasn't fallen off. How many times should we try the over-the-counter removal, and when should they come to you, and what would you do?
4-year-old this is?
Yeah. Child with a lumpy growth.
In a child of a 4-year-old, I'm very cautious to start. I'm not a fan of cryotherapy, freezing warts off. A lot of times it does cause a lot of pain, and a child is going to relate that down the road. They're going to not be
Every
happy.
time they see a podiatrist, they're going to go, I hate that
It might
guy.
not even just be a podiatrist. It could be just their family doctor. They're a pediatrician. There are topicals that can be applied to the area, essentially salicylic acid pads that are essentially, it's a medication that should help to decrease the plantar wart. They can just go away on their own as well. It's a viral infection.
I usually suggest a dime-sized piece of banana peel, the gooier, rotter, the more mature the banana peel, the better. A dime size, and then duct tape, and leave it on a day, and then replace it. Have you done the banana peel thing?
I have not done the banana peel thing,
but you have done the duct tape.
I've heard of the duct tape with yes.
I've had great success with it. Not perfect success, but
there are other.
The virus chooses to go away.
Yeah.
So.
There are also compounding pharmacies. I know it's expensive at times, but I mean, there's topicals, there's things. I would just shy away from doing any cryotherapy and watch it, monitor it, make sure it's not getting worse.
It hurts like heck to be frozen.
Yeah.
One man says, I remember seeing as a child a lumpy growth at the outside base of the big toe on my grandmother's foot. She called it a bunion. Now I see one on my right foot. Should I be doing anything about a bunion? Will it keep growing? If it's not giving me trouble, what should I do?
With a bunion, it is a functional deformity of the foot, generally caused by overpronation. It's a functional issue that we try to prevent from becoming worse with inserts, wider shoes, deeper shoes, all of those types of things.
But it might be genetic too, right?
Well, and I get asked that a lot about it being a genetic thing, a bunion, because mom had it, she had a daughter, son's gonna have it. It's the function, it's the genetics of your parents giving you your foot type that causes the bunion. Okay.
But the foot type is overpronation. Nobody understands that. Does it have to do with too tight of shoes?
So
we can go all night long very quickly.
Yes, it can be caused by too tight of shoes, which plays into the function of the foot. But yes, there are things that can be done. Is it going to be prevented? It's very difficult to say one way or the other. If it gets to the point where it hurts all day, hurts in your shoes, causes you activity problems,
surgery.
Likely need surgery for that.
Eventually.
Yeah. One woman says, I was taking medication for arthritis in my neck and back to help with pain, and I ended up in the hospital with ulcers in my stomach and atrial fib. What's your take on this? So she was taking medicine
she was taking an NSAID, and it caused a bleed, which is one of the common, not common, but one of the complications that can occur from it, and it's one of the risks you take by using NSAIDs.
Do you remember when back in the old days when you were first starting out in practice and they were pushing NSAIDs, and they had a different NSAID, non-steroidal anti-inflammatory like ibuprofen, naproxen, Aleve, all of those are NSAIDs, and they were pushing them to the max dose, and I did it.
I did too.
And I had patients, little old ladies, bleeding ulcers, caused hospitalizations. 800
milligram ibuprofen 3 times a day.
For months at a time. It was bad medicine. I mean, we were pushed by the pharmaceutical companies.
We were lured into what seemed to be a good deal, and we maybe caused as many problems as we solved.
Yeah, we did.
That's all said and done.
That take home though is a bleeding ulcer. You have to be careful because sometimes they can be cancer.
Yes.
So we need to prove that they healed.
Sure.
Well, that's it for our questions. Thank you for joining us on our Facebook page. We appreciate all of your questions and the opportunity to answer them. And until next time, from all of us here at On Call with the Prairie Doc, stay healthy out there, people.